All right. So next, we're moving on to a request from the Department of Health and Human Services, Division of Aging and Adult Services to approve the Marin County Area Plan for Aging for fiscal year 20. This is the 2014-2015 update. Good morning.
Good morning. Good morning, President Sears and members of the board. I'm Lee Pullen with Aging and Adult Services, and though we don't have a song or a mascot for you this morning, we're hoping you'll approve our annual update to our area plan. It includes objectives that we, along with our Commission on Aging, community partners and stakeholders, a number of whom are in the room today, will carry out in the upcoming year. This plan was developed with the guidance of our Commission's Planning Committee, and it was presented to the public at a hearing on April 10th. As you're aware, we are governed by the Federal Older Americans Act, funding, which provides funding for programs such as congregate and Meals on Wheels, family caregiver respite, case management, and a number of health and well-being activities. And these are services that allow our older adults to remain aging in the community, and it allows people like Frances, who at 101 years old is still living in her home in West Marin, where she receives case management, home-delivered meals, and friendly visitation through West Marin Senior Services. And most of our programs are contracted to our community-based organizations, and they help us form the network toward the vision of Marin being an age-friendly community for our older adults. Last year, you'll recall that our ability to carry out this vision was challenged because of the federal budget. We were expecting reductions to all of our services, yet that wasn't the experience here in the county for our older adults and our community partners, because this board backfilled and covered that funding gap for us, and we're very grateful for that. And fortunately, the federal landscape is looking better in the year ahead. So in addition to being able to provide the basic services over this past year, we looked at other ways to enhance the system of care for older adults. And for instance, with the help of our Commission on Aging, the Villages model of neighbor-to-neighbor assistance has spread from southern Marin, it's now in central Marin, and onward up to Novato. And another highlight was from two of our commissioners who led the effort that resulted in Sausalito receiving the World Health Organization Age-Friendly City designation, and that was quite an honor and quite an inspiration, as there are only 4 cities in all of California to be designated as age-friendly. So we hope to see that spread as well. So these models of community engagement and the programs for from our Older Americans Act are critical in a county where 1 out of 4 persons is over the age of 60, and in just 15 years, 1 out of 3 of our residents will be over the age of 60. We enjoy being the healthiest county in California, with women experiencing the longest life expectancy in the country and men the 5th longest life expectancy in the country. But as you know from other reports we've presented to you, there's a great disparity there, with that longevity ranging over 17 years depending on where you live in the county. There's also great economic disparity for our older adults. 1 out of 5 persons, 20% over the age of 65, don't have enough to make ends meet each and every month. Yet their income, which is just above the federal poverty level, creates a gap for them, an eligibility gap, because they're disqualified from public assistance programs like Medi-Cal. So it's with these health and economic disparities in mind that we approach some of our objectives in the upcoming year. Thanks to your recognition of the expected demands upon our aging services network, we'll be able to launch an Aging Action Initiative. This initiative will include a collaboration of our stakeholders to come together and address and take action upon some of the issues of most pressing concern. And we know from prior reports and talking with those stakeholders, there are about 5 areas that we want to look at in this upcoming year: mental health for older adults, dementia services and supports, senior nutrition, care coordination, and the economic disparity that I mentioned earlier. So in addition, we're hoping that this Aging Action Initiative will really create the foundation for increasing the collective impact upon our aging services sector. Some other activities we'll be engaged in. We're going to pilot a program to help people transition from skilled nursing to home, and it's based upon our successful Project Independence model that helps people go from hospital to home. And our Health and Nutrition Committee is going to engage the public in the difficult conversation about end-of-life issues and planning. And our staff intends to be actively involved in the prescription misuse initiative that the county has going on, so we can make sure that senior issues are represented. So a number of things for us to be doing in the upcoming year, and we certainly appreciate this board's support and guidance and approval of our plan, and I welcome any questions or comment you may have for me or staff. Thank you very much.
Supervisor Adams?
Thank you. Yes, I have two questions. I appreciate that you brought up the issue of pharmaceuticals. We just ran a take-back day for the county. We've been doing that pretty regularly for quite a while now. And it's pretty amazing how many pharmaceuticals are coming out of medicine closets that sometimes are getting into the wrong hands of our youth who are using them for not appropriate purposes. And one of the challenges is the narcotics and the meds that come in liquid form. And I think we need to do a little work in that area to figure out how do we safely dispose of those, because flushing it down the toilet's not the appropriate way. So I would ask for your agency to be putting on their thinking caps around that issue with us as we try to figure that out. And then on the issue of housing, I just wanted to announce that in the last couple of weeks, I've had 3 elderly women over the age of 70 who have contacted our office because their landlords are evicting them from their units after living in those units for years and years so that they can get the higher rents. And so where do we help? How do we help in an environment where we have only 2% vacancy rate? Our older citizens who are finding themselves in this situation, and if you have any thoughts about that.
It's a huge challenge for us, and it's a situation that often comes to us through our Adult Protective Services offices, where people are 3 days out, a week, or 2 weeks out, and at that point it's very difficult to find housing for our older adults. And even if it were 2 months out, it's hard to find housing for our older adults. I think this rubs up against our philosophy that we want our older adults to be able to age in their communities. These are people who've saved, who budgeted well, but this current economy and this housing crisis is finding them in this situation. So it's indeed a challenge for us in trying to find housing when older adults face this situation.
Other questions? Katie?
Yeah.
Supervisor Rice?
Yeah, thank you very much. I was good at the housing issue jumps out again with seniors as with across the community spectrum. There's a good article was it in the paper yesterday or the day before on housing, but it's right in front of us with our seniors and our most vulnerable that as a community we need to find ways to take care of our own. I wanted to ask you about the nutrition programs. On page 10, or I guess it's 11, you talk about the congregate meal and home delivery programs. And it seems, and mentioned that recently Good Earth Natural Foods withdrew from Sunday meal service. And if I'm remembering correctly, we've kind of had some trouble over the last several years in finding vendors to provide the various services. And I'm not into the weeds enough, but could you speak to that?
Sure.
What are the challenges there? Because it's really critical also.
Indeed, there have been challenges over the last few years in getting stability with a contractor to provide the congregate meals. I will say we're very grateful that Good Earth has come into the picture to help us out. It's delicious food. I've been eating senior meals all my life since when my grandmother worked at a community center. These are the best I've ever had. So we're really pleased to have them be a part of our network. The Fairfax operation, we wanted to extend service to another day in the week, and it was a pilot we started in the late fall or late summer with the Fairfax Church, and we just have not got the regular attendance to keep it going. So when we look at the cost benefit for Good Earth on a Sunday operation, it's not working out as well as we'd like to see. We still would like to have operations on Sunday, so we'll be looking for other places that may be available for us.
So with regards to this, the broader program in terms of the meal service, do we have multiple vendors, and is it sort of I'm geographically? I mean, it seems to me that it's going to be easier for a vendor to be providing meals if they're within the community or close
Sure.
by, just because you're of the the nature of the business. Is that how it works?
Sure. So for our congregate program, which we have serving in 8 places throughout the county, we have Good Earth supplying that food for us. They cook the food and they take it to the different sites. Some operate a couple of days a week, and most are just 1 day a week. Then we also have our home delivered program. So Meals on Wheels, that our Whistle Stop partner, their volunteer drivers deliver to the door. That food is cooked by Council on Aging, a nonprofit organization in Sonoma County. They make the food, bring it down here to us, and then our volunteer drivers deliver it to the home. I will say, since we're on the topic of nutrition, that we're really squeezed from both ends. The federal funding that we get is hardly enough for us to make it. We've had wait lists off and on this year with our Meals on Wheels program, and we know that there are communities that would like to see congregate sites open more than the 1 or 2 days a week. So that's something for us to look at in the year ahead.
Okay, and then my last thing was also on the prescription drug issue, and I was glad to see that there. And the other element of prescription drugs and is managing medications, and what a challenge that is for seniors, because so many seniors are on so many different medications. And I just wanted to highlight that because it also spills into one of the trends that we're seeing out in the emergency responder world. A lot of calls, 911 calls, bringing in paramedics and our EMTs, and sometimes it's warranted and other times not, but we need to be thinking more as communities, I think at the local level, identifying folks who are tentative physically, and how do we best serve them through our emergency responders and or not. I know it's something that's come up in the past, but that's going to be, I think, a growing issue. And it's a strain on the emergency responder system, but also it's something we need to pick up in different ways, I think.
Thank you.
Supervisor Kinsey.
Thank you. Thank you for coming to present the plan. Each year we see a tremendous number of plans move through the Board of Supervisors, and so many of them feel as though there's simply administrative requirements to meet auditable programs. This one has consistently felt to me like it's a very clear, very prioritized and articulate expression of what we should be doing and what we are doing. And so I want to thank you for that, and I hope that you and the commissioners who help you feel that the process is worthwhile. But from where I sit, it's a very useful document, and I want to thank you for that.
Thank you.
I saw an outstanding program on aging on Sunday night on the 60 Minutes program, and it really took on the fact that the population over 90 years of age is becoming and will be the fastest growing population. So watch out, baby boomers. It's all lies ahead. But the one takeaway message of what I thought was a really great program and had a lot of features that I think people could benefit from is that the best way for us to meet the needs of our elderly in our communities is to meet the needs of our population throughout their lives, and especially to have people to eat well and be active at an earlier age makes such a difference. And so I want to acknowledge that we want to focus our attention on our aging, but I think the fact that our department recognizes that from prenatal to elderly, we have an opportunity to make the life experience so much better if we can help our people and encourage our people to be healthy and active people. And so even in our senior years, that is of great advantage, and I want to encourage us to do that. Thank you.
Thank you.
Excellent point. So, I agree with the Supervisor Kinsey's assessment of this plan. There's really a number of extremely important goals and really good programs and objectives beneath each of those goals to achieve them. And one that I wanted to focus on for a moment is Goal 2, which deals with enhancing access to and dissemination of information about resources. One of the things that often comes up when I'm out in the community is people having trouble finding and learning about the resources that they need. And part of it, the plan I think is great because it's getting out substantive information, but people often they'll be in a crisis point in their lives where perhaps they have a parent who's in crisis and they need support services, and there isn't a place to go that at least people are aware of that has the full scope of resources available, not just resources through our county, but also services provided by our nonprofits. And so I'm hoping, I know the last item in here is creation of a website, but if you could talk a little bit about how do you solve that problem of getting the information out?